Hello everybody, let's go to CDC here. So here's cdc.gov, Centers for Disease and Control and Prevention. COVID-19, RSV, bleeding disorders, blood clots and all that type of stuff. Getting enough sleep. Let's view all the features. On this video, I'm going to be showing you guys how to go on the website and find out what you actually have so you can talk to your doctor in the right way. Colorectal cancer. There's always questions on Google, let's see here, the best medicine made so far. That's all they say. So the best medicine for sore throat. There's chloroseptic, which is good. It's almost like an antibiotic for the sore throat. Doctors may refer to some medications as non-steroid, anti-inflammatory, non-steroidal. That's for sore throat. But that's just what I mean. I'm just kind of putting out best vaccine. See, no one really knows what the best vaccine is. There's no such thing. The best word to say is beneficial. Beneficial vaccines. You don't need just Novavax. People need to stay up to date with each one of their vaccines. Most people do, which is good. The government wants people to be basing off polio vaccine. Chickenpox is a good vaccine. It was developed by an Englishman. Dengue is another one. I think this is something with the skin. Anyways, right now I'm working on an HPV vaccine. Better off leaving that alone, but I think that an hepatitis C vaccine or the right type of equipment to understand the development of hepatitis C would be very good. Tuberculosis, which is one of the oldest of them all, the granddaddy of the interventioners. It'll be chickenpox, but tuberculosis is kind of like the grandpa. This would be the great-grandfather. Rabies is older than the hills. All these vaccines are recommended for travel in some specific groups. I guess there's a lot of vaccines nowadays for travel. There's that. And usually I'll teach you one little search technique that I use. So let's say you're searching for something. So it'll be keywords, anywhere, and then the website. So it'll be medicine for increasing appetite. And then you want it from the CDC, so you just type CDC. Usually, most of the time, it'll come up with documents. I really wonder why people. There's a man. I do know him personally. He's a good guy, but I don't think he knows the reason why. White clots.
Bet you didn't see that. But if you were an atlas...
Should we turn down the volume so I don't get any copyright issues? White clots USA would be first seen clots. He has 7,000 comments. I'm subscribed. He's a good guy. This, this guy talks about how to make vaccines better. I think that's his whole struggle, to make vaccines the COVID-19 vaccine to be more influential and better. So I hope that does that. So anyways, the CDC recommends this will be in the YouTube description. The CDC updates and simplifies respiratory virus recommendations. So I'll just put this in with that. And if you go home, you go outbreaks. These will show you about all the outbreaks. Most of the time it's updated, it should be. Fungal meningitis related to surgeries. Fungal meningitis is from the past. It's from using gloves, and sometimes the people can be allergic to those gloves. I'm sure it talks about that somewhere in here. Most of the time it is from food. Like a surgeon would touch food and get it on their body. Meningitis is crazy.
My bowl.
Oh no, I don't have.
Yeah, you do.
It's out there. Oh. So anyways, salmonella infections. Most of the time you guys have to always clean your food. Make sure that you can even, I think I recommend, now that there's so many outbreaks at all the stores, I recommend even putting like gloves inside your stores, or even inside of your purses and stuff. So that's the outbreak list. Data and stats. Cancer. Alcohol use. Foodborne. So a lot of people are talking about they're getting heart disease from these vaccines. Number of deaths, mortality, 695,447. And that's the cause of death. That's the rank one. That's the big reason in America. Good to know. Good to know. Sorry, I should have known better. I've been so up to date with this other stuff I've been doing. Cabuneva. Deaths per 100,000. So there's 209. So that would be 20,000 people per 100,000. So heart disease in early 90s. Mortality rate 1990, 160 per, and now there's 209 per. So it's gone up. According to AHA journals, in 1990, it's gone up. Let's see here. In 1995, it dropped. Many countries. After the collapse of the former Soviet Union, so that means that heart disease stopped for a little bit. 423 people. So it does say, this whole thing that I summarize it up as, basically talking about the stressors of each country. There you go, it's an abstract. Data. So it's the mortality rate upon Central America. 8.43 deaths per thousand. So that would be 18 per thousand. So that's worldwide, I believe. Number of deaths would be 700,000. Let's just type in heart disease quick. People like to do it like that. I do too. There's a lot of heart disease. Most of the time it's from irregular. More than 3 million. More than 3 million cases. It's a lot of cases per year. But with proper treatment, your irregular heartbeat can go away. So anyways, at the end of this video, heart disease prevention, I'm gonna have to go with eating healthy, being physically active. But all these things, don't overdo it, because your lungs are just recovering from all this COVID. So don't overdo it, because it can cause phlegm. And phlegm is spelled like PHELGM. A more thick-made mucus, and that will come over to the heart, and it'll go through the heart, and most of the time it will cause your heart to get built up. How do I get rid of this phlegm? Hydration. Yeah, the best one, it would be the Vicks purifier. It's purifier. Like, I found one in the store one time, and it was a nice one in Walmart. This one right here. So humidifier, take that and use that. It's very good for the air you breathe. Anyways, thanks guys, and remember to subscribe to this YouTube channel to stay up to date. Bye bye.